Well, aloha everyone. You know, NDPTC didn't invent Thursdays, but they sure gave us something to do. So, my grandfather would always say, if it doesn't begin right, how's it going to end right? And let's begin with a pule, just to get centered and to all be present with each other. Mai kaunalipo, mai kaunalipo, mai kahikina, mai kaulana. Ye hele mai oi atu e, hele mai oi e ku, a hina, a kanaloa, a ka nei, e ui, e ninau, a ye kalaira, kawai a kaane. Where is the water of life? Where is the water of Kaane? Where is the water that holds us all together and brings us all together as one? Our relationships, the way we relate to the cosmos, this is everything from our ancient past to our modern preparation to the way we see the world and the way we see each other. Mahalo ke akua. May it be on earth as it is in heaven. Mahalo ke akua. May we be a blessing to each other. Mahalo ke akua. May you be a blessing to us all, particularly in these times, these historical, social, critical times. May we all find a way to be kind to one another. Mahalo, mahalo to all those at NDPTC for everything you do. Ew. Thank you, Karl.
Thank you, Kalani. It's great to see you. It's great to see all of you. You know, this is our third Thursday. I apologize for wearing the dark glasses. I just went through a eye treatment. So it's not meant to be a political statement, but it is what it is, right? Again, I want to thank you for joining us. It's third Thursday, which means that we wear our black NDPTC shirts. Ordinarily, we would be parading up and down 4th Street Mall and inviting people to join us and learn about the good work of the center here. Things are a little bit different because of the pandemic, but this session today should involve the same elements of any third Thursday. You know, we get together, we share news and gossip, and then we have a talk, and we have a very interesting talk about cascading disasters in a time of COVID-19. And then we continue to work together on the important work that the center and all of us are doing together. In terms of news, I want to report to you all that NDPTC is alive and well, and we've just got notification of our renewal of our funding for another year, and we are continuing to make adjustments to the changes that have occurred. I want to report too that we've had success in transitioning to virtual deliveries, and that in large measure is due to the hard work of our team with Lydia and Russell and Eric and Nate and all the others as part of the NDPTC team. I want to again thank you for your efforts and the efforts of the entire team for coming together on this, because I know it's been challenging. One of the things that we did was a survey, a questionnaire that we sent out, and we got, I think, almost 60 responses from staff members, from SMEs and others. And we were asking, how are you doing? What have been the impacts of the pandemic? And what are some of the things that we can do to do our work more effectively in these challenging times? We have those results, and I didn't want to do a PowerPoint for you, but some of the highlights from this is that I think over half of you reported that all things considered, you're doing okay. You know, that you've been able to make the adjustments. There have been others that reported some hardships and difficulties associated with the uncertainties, associated with shifting from different ways of doing business, and the complications associated with this pandemic. And so what we've done with that information is try to do an assessment of how does this affect our operations. And what we're trying to do is to use this information to support changes and things that we can do to make our center as resilient and effective as possible. And so you'll continue to hear more about these adjustments and changes that we hope to make. Part of this is building it back into our strategic plan, our planning process, which again has three elements. I mean, first of all, we want to be able to improve the quality of our courses and the efficiencies of our delivery. But we also want to have deep engagement with all the people that we interact with across Hawaii and beyond. And then, of course, we want to remain a kind of adaptive, resilient learning organization. So again, I think that the survey that we administered and this gathering will help us in terms of continuing on the important work that we're doing. Before I hand it over to Eric to introduce our speakers for today, I want to again express my gratitude to all of you for all the efforts, the hard work, and commitment that you have shown through these trying times. We are very much concerned about the pandemic, and we will do whatever we can to help and assist you all to stay healthy, to stay engaged, and then to be successful in all of your endeavors. So with that, I'd like to turn it over to Eric to introduce our two speakers for today.
Okay, today our presentation is on cascading disasters in this COVID-19 pandemic. As you know, everybody's been, practicing social distancing, and there's quarantines somewhere, and then but during this pandemic, natural disasters don't stop. So today we have several speakers that will talk about this subject. Our first speaker is Jason Krause. He's the Associate Director for the National Center for Biomedical Research and Training at Louisiana State University in Baton Rouge. As you know, there has been a lot of hurricanes going through Louisiana this year. And our second speaker is Owen Shieh, and he's within the training department at the Joint Typhoon Warning Center. He's the head of the training department at the Joint Typhoon Warning Center is at Pearl Harbor, Hawaii. So for people that have questions, can you put it into the chat box? Or we can wait to the end of all the presentations before we can answer your questions. Jason, where's Jason?
Aloha, everyone. Dr. Kim had asked me to talk to the challenges of dealing with our hurricane season here in Louisiana while we still face such a tremendous threat from the COVID-19 pandemic. But before I get into that, I want to reiterate some of the things that Karl said regarding the training within the National Domestic Preparedness Consortium, like the NDPTC. NCBRT is part of the broader training community, and we have been, as Hawaii has, diligently working to transition to different types of remote delivery while we were limited in our in-person contact. Some of what we do has been a struggle because lots of our courses are performance level, and we cannot do hands-on training remotely with detection and monitoring equipment and active shooter type training. But we've been able to transition lots of our awareness level courses to Zoom-based remote delivery. And because biological incidents is one of our training lanes, from the beginning of the pandemic, we have put out a significant number of pre-recorded webinar style informational courses, mini courses is what we're calling them, that maybe last from 5 minutes upwards of 20 minutes. And we've had great success with agencies throughout the disciplines, download them and incorporating them into their training. We hope, as we have the ability to increase our mobile deliveries again, that we will be able to, in a safe fashion, and like Dr. Kim said, we're looking at all the ways we can mitigate the threat of COVID while we're doing those courses. So in regards to the topics of, how has the pandemic affected our ability to handle hurricane season? Clearly, unfortunately, we're in a good position to talk to that. As far as COVID, if anyone has watched, Louisiana has had quite the struggle with the pandemic. It has only been very recently that we have consistently got our positivity rates below 10%. We have on numerous occasions reached capacity in our ICUs in the hospitals. Internal to NCBRT, we've had a handful of positive cases with our staff, and fortunately, most of those have been minor, but unfortunately, we have suffered a loss. One of our instructors, Jim Sellers, one of our IDW instructor development workshop instructors, passed away a couple of weeks ago due to COVID. So it's a real threat here in Louisiana and to the entire nation. And then, of course, we have very recently suffered 2 hurricanes, Hurricane Laura and Hurricane Delta, in very short order. And so when you combine these two, there's lots of challenges and considerations. I really want to only speak to one is what I'll hope to drill down to, what I see as kind of a high level discussion point that we've encountered as we've talked to people across not just the country, but across the world. So pre-hurricane season, because of the impact of COVID, here in Louisiana, as everywhere, we're already suffering a decreased ability to address a range of threats out in the world. Our law enforcement, our fire, our other emergency management personnel, or have a diminished capacity. Folks are either actually sick, folks are in quarantine at different times. There's been great economic impact to the ability to sustain training, to sustain payroll. Not necessarily here in Louisiana, but we have feedback from across the country on departments that are losing a significant amount of personnel to retirement because they just can't sustain the operations and choose to retire. That's a particular problem for New York City Police Department. So COVID's already greatly impacting our ability for numerous disciplines that would normally be involved in a hurricane response. And then as hurricane season approached, one of the most obvious and one of the things that a lot of work and thought was put into was the concern about what are we going to do with sheltering. And that's a significant concern. In Louisiana, we have what we call a mega shelter that was built in 2010. It's in the city of Alexandria. And holds close to 4,000 people. 3,000 just shelterees because they have to leave the evacuation area, and then a 700 person capacity for those with some type of medical risk. And now that's the plan for that was, you know, pre-COVID, not pandemic, just this is an evacuation for a hurricane. A lot of good work was put in determining, you know, all the tactical and operational procedures and policy necessary to mitigate the threat of COVID as people evacuated, sheltered at the mega shelter. You know, so PPE protocols, screening of shelterees and screening of staff operating the shelters. We reduced the number of spots in the mega shelter and reduced congregate facility use and increased non-congregate facility use, such as hotels. And so a lot of work in, you know, temperature checks, screening for staff before they even leave home. And in fact, we're collaborating with another NDPC member, the CDP, to develop a video specific to pandemic shelter operations. Now, Alexandria was picked as the location for the mega shelter because it's in the northern part of Louisiana and is considered a relatively safe location to support zone operations during and after a hurricane. But it's not a cold zone at this time from the coronavirus. And in fact, there's no traditional cold zone in relation to the pandemic anywhere. And that's what I see as the kind of true challenge that has this cascading consequence when you're looking at, you know, what we've seen as traditional disasters that we face every year in the form of hurricanes, now combined with a very invasive pandemic. You know, for the most part, our entire emergency management system is designed around the concept of there being safe harbor somewhere. You know, whether a disaster is naturally occurring, accidental, or even intentional, always been a discernible exclusion zone, containment zone, and then support zone, or hot, warm, or cold, if you prefer that terminology. So for instance, during the aftermath of Hurricane Katrina, LSU was able to host a wide range of support organizations from all over the country, came to LSU. We set up our Emergency Operations Center combined with the State Emergency Operations Center. And we housed personnel and agencies from not just all over the country, but all over the world. But if you think about how those during that time and now the support functions and the support is in recovery is designed, you know, FEMA activates teams from various locations outside of an affected area and then relocates them to a joint field office near the affected area, but normally in a safe zone. Public works companies send support from near and far. In extreme cases, other states send National Guard support. You know, all these people from all over, often performing work in close quarters. You know, a lot of recovery work is not just performed in close quarters, but it's active type of work that in this type of pandemic has people heavy breathing, close contact. You know, they transport together in trucks, house together, and then everyone returns home. And so just at that level, we have the potential of where's everyone coming from and what potential COVID risk are they bringing with them? And then when they leave and go home, what are they bringing from then operating in that environment? And then even looking at recent high threat biological incidents such as SARS, MERS, and Ebola, you know, they were all traced within particular hotspots that could be identified on a map. And governments and international organizations, emergency operations centers, everyone guiding the response to those outbreaks never were at risk of being hobbled by the threat that they're fighting. During the Ebola outbreak of 2014, I went to Monrovia, Liberia with the team, and we were working with the Liberian National Police. And so during the day, we felt that there was some level of risk where we were operating. But even there, in that more tactical level, we figured once we got back to our lodging that we were in a relatively safe spot and looked at where we were working at the National Police Headquarters or out in the field as the hot zone, and then at least we were in some level of a cold zone back at the lodging. We never, I don't think, could have imagined the pervasiveness of what we're facing with COVID-19 and its ability to disrupt leadership in that level of emergency operations command and control. Political opinions aside, as Karl mentioned earlier, but if the coronavirus can reach the President of the United States and within the White House, or Boris Johnson in the UK, or the President of Brazil, or Justin Trudeau's wife, if this virus is reaching into the leadership of the world, it can reach anyone. And it's not likely to go away for any time. Certainly given climate change and all the other modern impacts to the world, there is likely to be another significant emerging novel virus within our lifetimes. And I think that's really the notion that we don't need just to have SOPs and the ability to deal with something at the incident, but that there's no real safe harbor, that the California Emergency Operations Center in Sacramento, while it may not be under direct threat for the fire response that is attempting to coordinate, if they do not manage that center appropriately, then the threat of COVID, the risk of COVID, can disrupt their ability to manage fire response. And then there's just further cascading problems from there. So we really need to examine strategically, how leadership functions beyond the specific incident. How should we have redundancy in leadership? Should there be dual teams? But that's where I see the true. I'm not going to say that I have the answers to it here today, of course, but that's where I see a true challenge being, and it's something that we've never really looked at before. What if there is no safe harbor out there? So thank you very much.
Thank you, Jason. So next, we have Owen Shieh.
All right, thank you, Eric. I will. I'm going to share screen. I have a handful of slides I'd like to share while discussing this topic of cascading hazards. All right. Thanks again, Eric, for the introduction. To Karl, Lydia, the whole NDPTC team, thank you very much for inviting me. It's great to see all the familiar faces out there in the Zoom meeting. I'm happy to see that Third Thursdays are continuing. It's such a great forum to exchange ideas and talk story. So I was invited to speak about the topic of hazardous weather and the cascading problem, cascading challenges during COVID. And so I'm speaking from the perspective of a meteorologist who has to deal with a lot of operational issues. But as you heard from our previous speaker, a lot of the problems on the emergency management side are, of course, oriented around sheltering. So I'll talk a little bit about some of these challenges that we're facing. But first, I do want to kind of introduce myself and my background a little bit. For those who I may not have had the opportunity to meet yet, I was with NDPTC from 2012 to 2016. And in that period was when we kind of stood up the weather and climate training course development. And it was a wonderful opportunity for us to not only develop the training courses, but also engage the wider community, including meteorologists from the National Weather Service across the country, in trying to come up with a better way to communicate what we know of the science of the hazards to the decision makers across the field, in particular, the state and local emergency managers and first responders. All the way up until that point, up until what NDPDC contributed to this field, the National Weather Service was basically the sole from the scientific perspective, was the sole entity that provided outreach to emergency managers in terms of technical training in meteorology. Warning coordination meteorologists throughout the National Weather Service, particularly at local offices, would outreach to the local first responders, emergency managers. They would do skywarn spotter trainings, things like that. And so the value that NDPDC added to that program was to have a nationally standardized FEMA certified set of courses to allow emergency managers and first responders to have a baseline level of understanding of various hazards, whether it be hurricanes or tornadoes, or just weather hazards at large. And so the thing that was lacking with the training and outreach side with respect to meteorological hazards really was the standardization. We do know that all disasters are local, of course, and so that's what we did at NDPDC is, of course, not meant to replace or otherwise change the local outreach of weather forecast offices to their local emergency managers. Since 2016, I moved on to the Joint Typhoon Warning Center, so I've been serving as the Training and Readiness Department head there. And the Joint Typhoon Warning Center is an operational center. So part of my transition from training to operations, while still living in the training world, was really to see the challenges on the front lines of having to predict weather under time pressure with large consequences. And that's something that I think that operational experience is something that in the training world can sometimes be lacking, but is very much necessary in terms of proper outreach to decision makers. And so Joint Typhoon Warning Center is under the Department of Defense, and specifically the Navy and Air Force. We're responsible for forecasting tropical cyclones across the entire Eastern Hemisphere. That includes everywhere shaded in blue on this map. So that covers about 85% of the world's tropical cyclone activity. Everywhere west of the international date line in the Western North Pacific into the Northern Indian Ocean and the entire Southern Hemisphere. We share a boundary with, as the storms cross the international date line, we share a boundary with the Central Pacific Hurricane Center. And that, of course, is a National Weather Service entity located on the University of Hawaii campus. And then the National Hurricane Center in Miami is responsible for storms east of 140 degrees west longitude. And so we kind of carve up the world into these different operational regions. During COVID, the challenges, of course, is that weather doesn't stop 24/7. We still have to issue forecasts. And so we've had to put in place a lot of mitigation procedures. When I teach my training courses, whether it be for our own forecasters or some of our outreach trainings to forecasters out in the field across the military stationed in East Asia in particular, I've done a few training courses from my room at home. And then at other times when we have to be in our office, we're all wearing masks. It's very strict social distancing guidelines, etc. Just a little note for those who may be interested in just learning more about our operations. We did recently allow cameras into our operations area. It's pretty rare that we do that, but we did that to host a National Geographic documentary series called Gathering Storm. They actually did a nice bit about our operations. So with respect to cascading hazards, I always like to start a discussion using this particular figure. This was actually something I created at NDPTC for several of our training courses. This basically summarizes all of the different hazardous weather events organized on a spatial and temporal scale. And so in just one snapshot, we can see how these larger events can affect these smaller events. Because a lot of times these smaller events are actually attached to these larger events. So a tornado is a good example. Tornadoes form typically from thunderstorms, and thunderstorms can be part of a larger system such as a tropical cyclone, hurricanes, and typhoons. And so we see that within just meteorology, we already have this cascading hazard structure. We know that these synoptic scale systems can then subsequently arise from these larger planetary scale events, right? And so we see that within just the hazard itself, there's already this cascading structure. And so operationally, there's a lot of challenges associated with how do we communicate and issue warnings for each of these events, particularly when they're overlapping. Now, in the age of COVID, this becomes even more complicated. So one example, this little screenshot on the right is actually from an old research paper, 1965. So since the 60s, we've actually known that when a hurricane or tropical cyclone makes landfall, the frictional effect of the landfall on the east side of on the right side of the storm. So if the storm is making landfall like this, the right side of it, there's typically a burst of tornado activity, thanks to the frictional effect. And so what happens is on the right side of landfall, particularly along the Gulf Coast. So this is true particularly of states from Texas to the west coast of Florida. When there's a tropical cyclone or hurricane making landfall, that to the right of track is a lot of tornadoes. So from a sheltering perspective, even without COVID, we know that there's a complication here, right? Because generally speaking, hurricane sheltering, the purpose is to get people away from the water. You're not necessarily sheltering from the wind, you're sheltering from the storm surge. And so because of that, the idea is to try to get people into these large buildings, these large structures. And so high school cafeterias, gymnasiums, things like that. But then we also know that tornadoes, the primary impact is wind. And you do not want to put people in these large shelters for tornadoes, right? That the advice is, of course, to go into smallest room on the lowest floor, windowless. Windowless room is ideal. And so even within just the tornado inside hurricanes construct, there's already issues associated with sheltering. Well, now with COVID, things get even more complicated. I want to say one quick thing about seasonality. So I think we all know that hurricane activity follows seasons, right? The Atlantic hurricane season, not usually as active as, say, the Western North Pacific, but we do see seasonality with a peak happening right around now, from September to mid-October. It's typically the peak. And so we actually saw the messaging of the American Meteorological Society kind of following the hazards in terms of trying to figure out how to deal with the complications of COVID. And so this spring in April, when the tornado season was just starting up, the American Meteorological Society actually put together the tornado sheltering guidelines, just a 2-page memo that they sent out. The language here was selected very, very carefully. As soon as this hit the press, all the news agencies started talking about how best to shelter from tornadoes. Now, you can see from the text, it's very, very open-ended, but the idea is that a few of the key things that jump out is that the idea is people should not, because of COVID, ignore tornado warnings, that the likelihood of a tornado impact that's imminent, if you're in a warning, is much more significant in terms of risk than sheltering. However, because there are local differences in sheltering policy, it's important for people to then prepare before the tornado warning happens. So in other words, don't take for granted the usual sheltering plans. So AMS, the American Meteorological Society, went out of their way to try to get people to think through where they would go if a tornado does threaten, because the average lead time for tornado warning is 13 minutes. And so there's really no time to be reading up on the local county COVID-related policies for sheltering when a tornado warning is issued. By the way, just wanted to give a shout out to so Tom Bedard, former NDPTC course developer. He actually was on the committee that helped put together this sheltering guideline. The Committee on Emergency Management for AMS was part of this. Fast forward a little bit, later on in the summer, we had hurricane preparedness guideline issued by the AMS, again, focused on sheltering. We actually saw through the various hurricanes so far this year that sheltering was, of course, the primary primary challenge that COVID presented to the field. And you see that through various news headlines, whether it be on the preparedness side. For example, the Florida Division of Emergency Management tried to encourage people to prepare for COVID in a different way than they would normally prepare for hurricanes, right? The rush on toilet paper, on water, on essential supplies should be different in preparation for a hurricane than, say, for a long-term pandemic, right? And so a lot of the initial messaging was oriented around comparing and contrasting how you prepare for these things. And then once the event is actually underway, National Weather Service in Alabama went out of their way to say, hey, don't avoid sheltering just because of COVID, but be prepared. Make sure you have face masks. Make sure you're looking into whether or not your county even is running a shelter. During the recent hurricanes in Louisiana, some of the local governments actually subsidized hotel rooms so that people can evacuate to them, and thereby reducing the population of residents in shelters. And so there are a lot of different mitigation reasons. And then, of course, there's some strange side effects of this COVID pandemic on the whole weather warning system. For example, every year there's a committee of the World Meteorological Organization that actually gets together to decide which hurricane names to retire. Because usually a big hurricane like Katrina or Sandy, the names are preserved forever by retiring them. Otherwise, the names are actually recycled every 6 years. And so Hurricane Dorian, the one that had threatened Florida last year, Hurricane Dorian, the name wasn't retired yet, even though it should, because the committee didn't have time to meet. They reserved just the most important issues for their Zoom meeting. And so a lot of interesting just consequences of this COVID pandemic. And of course, we're still in the middle of a hurricane season. We've had only 18 storms in the Western North Pacific, but 26 in the Atlantic. So we still got about a month and a half to go in the Atlantic hurricane season. And it's a lot more active over there than usual. And so with all these things in mind, I'll leave it open for questions and discussion.
Any questions for Jason Krause and Owen Shieh? We have two comments for Jason in the chat. Monica Goen says she's sorry for your loss, Jason, for your friend and your colleague. And then she thanks you for your great synopsis on a difficult subject.
Thank you.
So you folks are free to unmute yourselves if you have any questions. If you don't, we'll be around for a little bit.
I have a question.
Sure.
Can Jason speak a little bit more on the crisis of the leadership function in a pandemic, because it's something that comes up time and time again. How do people make decisions at the county or the city level as the pandemic unfolds, and who do you follow and on this? So maybe you should just explain or unpack that statement a little bit for us.
Oh, Bill, it's great to see you. Maybe you should just introduce yourself briefly, because I'm not sure everyone knows who you are.
Okay, I'm Bill Simbieta. I'm professor of city and regional planning at California Polytechnic State University in San Luis Obispo, California. I'm basically a land use planner and an economist who's gotten into the mitigation and hazard realm of the past 20 years. And one of the things I did in California was I wrote the last 4 state of California multi-hazard plans for the governor in California. I have a lot of work in Japan and also in Chile. And in 2002, I did a large study of 15 communities in Central America that were hit after Hurricane Mitch, and how they recovered and what kind of recovery strategies these communities, were mostly poor communities, took. And it taught me a lot about not only local self-determination, but the factors required to get communities forward in their journey to recovery, which is not recovery is not an end state. It's just a process of moving to a place of viability for a community. And so that's who I am. But I have a big interest in cascading, the nature of cascading events, but also in the fact that we were so ill prepared to address the pandemic in the United States, because somehow we thought that the public health part of the US response and government would take care of us. And that's obviously not true. So, and one of the issues is how leadership arises and how decisions are made at the local and county level. And because there's lots of decisions to be made, there's not a single one. I think that's why I asked this question of Jason, and this quick realization that you had is that you had a 4,000 bed facility to house people, but that 4,000 bed facility, which is designed for a different kind of disaster, doesn't work in a pandemic because you're trying to get people away from each other, but you didn't realize that in the beginning, or it wasn't designed for that. So my interest is fairly deep here, and I really appreciate Karl sending me an email about your meeting, which I took my time to work on. And but I'm just interested in this emerging way that you would deal with pandemic planning and mitigation. And I think it's a conversation we haven't had yet and need to have, because at least in California, we see a changing, governor's position on this continuously, change in personnel in the public health sector department. So their leadership is a big deal, but leadership occurs at all levels. So, but I really want you to talk, Jason.
Yeah, sure. Well, for your original question of, unpack how the decision have worked at the state, local, and then of course federal level, and then who should be listened to, that's an unpacking that probably is going to take a few years to do. I think what one of the things you mentioned is it is painfully obvious, I think, that we were very ill prepared for a pandemic such as this. We have the biological incidence lane within the NDPC, and primarily what we focused on over the years is specific terrorist use of biological pathogens. But of course, we've looked at pandemics and to include work outside of the NDPC with Ebola. And we have looked back at the training that we've done in the past that was in line with national objectives and national preparedness plans. And it was the plans and the training that state and locals had built their responses against. And it was laid out very nice and neat. In some of the internal discussions that we've had, is that even a pandemic response was laid out nicely like a chemical incident response. You're going to have an area that's affected. You're going to send responders who are going to prepare themselves to engage in that area. And then decisions are going to be made outside of that area from an unaffected, be it, emergency operations center or the governor's office or at some level by an uninfected area, and the strategic national stockpile is going to work perfectly, and this is going to work perfectly, and in clearly, my opinion, we had a very nice looking plan on paper for something potentially like SARS or even Ebola, which is, you know, highly contagious, highly serious, but, you know, almost more obvious of where's the affected area and what's happening. Whereas in you know, almost a blink, we have COVID everywhere, and none of those perfectly laid out plans that look great in the planning worked. It is as hard as it is for some people to want to admit, the national strategic stockpile did not work. And that's not the fault, I don't think, of any one administration. Really, that was a building neglect of that system. And so I think at the failure point of those plans, when all of a sudden we're like I said, everywhere's a hot zone, then without clear objectives, we have contradicting information and direction from various levels of government. And then of course we could go off in a whole nother angle of how politics affected a response. But again, I think don't have enough time to do that in a Thursday meeting.
Yeah, but I think you raised both of you raised a really good point about how transferable the experiences, the plans, the leadership is for response, but also for recovery as well too. And so that's a question that I would ask of both Jason and also Owen, having thought about these different types of weather threats, man-made threats, other types of hazards. How much of that is our preparedness of our system of response and especially recovery relevant or useful in the case of the pandemic?
Well, Karl, Bill just mentioned that, you know, recovery is not fully in state. You know, it's a process. But in the case of the COVID-19 pandemic, you know, we're in this continual cycle of it's not even a process that has some end result in it at the moment. We are in this just never-ending cycle of we're in the incident and attempting to recover, and it's you know, like I said, my main point without being able to offer solutions is that as a whole we were not prepared for such a situation, and so we really need to take a look at, you know, how do we modify for the future for other situations such as this.
Right.
You certainly have to learn how to work under conditions of uncertainty. I think that would be the first decision rule to put down. You know, how do you deal with uncertainty? And that is something you can chop up into, you know, little uncertainty and some, you know, levels that you could scale that. But Craig Fugate, the former FEMA director, said that this is a borderless hazard. And just by saying that allows you to look at this as something that before you said, okay, this is an incident command kind of event. It's like in fires, there's an incident commander and, you know, decisions are made and resources come. Here, the question of who's the incident commander is not clear, but because it's borderless, that's why it pulses, as you say, it spreads, it comes back and you do things. And these are really something that thinking in terms of levels of uncertainty and how do you get the uncertainty into a frame that you can work with, I think is important about going forward. And the more you read the science literature on pandemics, the more you say, well, they knew it was coming, but somehow what they knew was coming wasn't translated into how do we as a society address it. So it's this idea of forward-looking stuff under conditions of uncertainty has to be pushed a little more than it's been pushed before. Because as you say, I mean, right now in Louisiana, you have, super high, rates, and those are going to pulse and go back, and so that you have to do something about it, and I think you basically have to choose what level. Is it the city, the county, or the state who's going to provide the leadership into the areas of uncertainty where everyone can take action? That's my point of view right now. But just to wait around and say it's a bad thing, and I've been reading different pandemic plans or statements in different states, take them different ways, but the question of in anything in which it's biological, that the first thing you're trying to do is to limit the spread rate, right? That's the number one thing. You can contain it. In the pandemic, we never directed ourselves to understand that well enough. And Karl's written several things in the newspapers, what I call the 5 T's, which I think is great stuff. But that's where I think you got to go and say, how do we deal with the uncertainty that we live with every day? And that's my 2 cents in this story. But thank you.
If I may, I'm recognizing that I'm in the company of very accomplished professionals in the response and discovery phases, particularly. I myself am a volunteer. My name is Alice Saul, in a neighborhood in East Honolulu volunteer group, and most of our effort has to do with community outreach, kind of the preparation side of it, the education side of it, more in line perhaps with Owen Shieh's efforts, but trying on a one-to-one basis. We've participated in fairs and get to speak to the neighbors, and it's always been interesting because up to now, in the few years that we've been doing this, talking about hurricanes and perhaps earthquakes and things like that, and there is among some of the community members a kind of a Chicken Little Henny Penny scenario where we keep telling them, well, maybe the sky is falling, and they don't really want to deal with it. So in our current circumstances with the pandemic, aside from the political aspects of what people feel they need to do to protect themselves and their families, I think it's just recognition that it's perhaps our collective human nature to not want to dwell in that place. But I would really like to see the prospect of these, like a pandemic, even though I've seen it written in some of the training materials I've received, it's really not addressed very much. I think people don't have a clear understanding of some of the risks and threats, and this that's why we're seeing the resistance to doing what we might consider the right thing all over the country. I think I've said my piece. I would just like to see more materials to work with, better ways of incorporating the possibility of these things occurring, perhaps in the education curriculum, things like that. Thank you.
Yeah, these are great comments, which again reminds us about what the role of planning is. I mean, it's knowledge to action, and what scale of action we're looking at, what's the locus of action, what are the things that we can do. And part of it involves building the information base so that we can better manage uncertainties, but also identify the areas that we really need to prioritize, to focus on, and so forth. So a lot of our efforts have been trying to anticipate vulnerabilities, the locations, the hot spots, the areas where we can apply various strategies for addressing this. I think I gave a talk a couple weeks ago where I said that one approach to thinking about the pandemic is a lot like a wildfire. And what we might be considering to do is to think about not just where the hot spots are and where it's, but what's fueling it and the direction of travel and so forth. So, and I think that technology and the way that we get and share information plays an important role. I hope that a future Third Thursday can also focus on the role of technology. You know, we developed FEMA's first social media class. And I think that there, in addition to social media, there are other channels through which people receive and share information. So I think these are all very relevant and important topics to cover. I don't know if Owen or Jason have anything to say or to close off on.
Yeah, I would just say I think everybody who's spoken up has made some great points, and that without, I think what we've witnessed is without, you know, a clear understanding of both who is supposed to be given the direction and guidance, and a deeper base understanding of biological threats, not just with you know, members of the government or responding agencies, but the public that's being impacted by the pandemic. In the absence of that clear understanding and direction, people both at the government decision-making level and the personal level has decided to create their response to this the way they wish it was. And so therefore that's leading to a lot of challenges and issues. And I do think we have a lot of work ahead of us, but you know, we have the opportunity to look really closely at a lot of lessons learned and to make some improvements for them.
Yes, thank you.
And I think an interesting parallel with this pandemic is with climate change. You know, I think hazardous weather is much easier to communicate in terms of preparedness. Tornadoes coming, you have 13 minutes. Hurricanes coming, you have 5 days to prepare. These are all things that as humans, we're more apt to wire our minds to be able to respond, to prepare and respond. Climate change is many, many years. And not only that, but there's an individual incentive to not do what's good for the whole community because we don't perceive the risk the same way as everyone else. So with lack of empathy, we are incentivized to not work toward the collective good when it comes to climate change. And that's kind of what we're seeing with the pandemic too. And so with climate change, extremes get more extreme, wet areas will get wetter, dry areas will get drier. And we're kind of seeing these hotspots of activity with COVID as well. And so it's a very interesting parallel. And I think when it comes to communication, differing strategies will be required for the different scales.
Great, thank you. Any other closing comments or thoughts before we
a question
end this?
in the chat for Owen. This one is Monica Goen again. She said she loved your slides and she appreciated your points about risk communication, risk management. And she's asking what's more significant immediate risk, COVID, tornadoes, hurricanes.
Okay, I'm looking at the chat window. Yeah. Well, given so the common thread with those American Meteorological Society statements is that if you're under an active warning, that the more immediate risk is, of course, the weather event. However, there are some consequences of sheltering that may be associated with the pandemic, such that the place you may normally go to for shelter may not be open, or your access could be limited, right? And so even if you try to take action in response to the more immediate weather threat, you may not be able to do that because of these other consequences of COVID. And so the idea is to just think further ahead, try to be even more prepared with more self-sustaining go kits, know where your shelter should be if you had to go, long before the hurricane arrives, for example.
Okay, well, I want to bring the program to an end. I want to again thank Kalani and Owen and Jason for their provocative presentations. And I especially want to thank all of you for joining us. I see we have, over 60 people that have joined this session here today. I think it would have been hard to fit all of us in the conference room. And so there is some benefit to this virtual reality that we're in. Unfortunately, I do think it's going to be a while before we go back to more face-to-face normal third Thursdays. But I do remain hopeful and optimistic that we will be able to continue to connect, to share information, and to learn from each other. So once again, thank you all very much for joining us. I think we'll stay on. If there are others that want to talk informally, please stay on. Otherwise, we hope to see you again in person or virtually in the short future. Thank you again.